with Michelle Marquez. I am Robin Verdine, your host, and Dr. Walter Tom from drtomcosmetic.com from 707-542-8346. 3 locations now: Santa Rosa, Napa, Maui, on all the social media platforms. Dr. Tom Cosmetic has been nominated 8 years in a row by you and added, the best surgical team. Thank you so much. And then the last few years in a running, the best esthetician. So welcome to the program, Dr. Tom.
Thank you, Robin. Thank
here.
you. Thank you very much, Robin. And thank you for being here. It's been a while, and we're so happy to have the team back. The band's back in town. We have Michelle. Hi, Michelle. Hello. We have the team back in town, which is fantastic.
Feels good.
Thank you for being here, Robin.
Thanks for having me.
It's great to have you here, and thanking our listeners. And again, as you're kind of giving our lauding us about all the accomplishments, we couldn't do it without our patients who trust us, and to our listeners who tune in. And we do have a wonderful following of people, non-patients and patients, who listen in, and we appreciate you. Thank you.
Since 1999, is that true? Is that when you started?
I'm not sure why. It's been a while. We've been at this game for a while. So thank you all. And Robin, thank you for being here. And I know every week you always check in with me, and even when you're on sabbatical, like, what are we going to be? What's your topic for this week? And I appreciate that. And so today I'd like to talk about something we kind of touched base a little bit on that before, but it's something, in my opinion, is kind of really new for 2024, and that is SkinVive.
This term, I have no idea what this term is. You're just throwing me a curveball here. So I need to, and what is SkinVive? What do I need to know about it? And thank you for being here to let me know, because you threw me a curveball. I have no idea.
So SkinVive, and that's spelled SKIN, and then one word with a capital V, VIVE, like Skin Alive, Vive or Viva Las Vegas, right?
Got it.
And so really it's about bringing our skin and making it be more alive. What SkinVive is the key here, the phrase that I would use, it's a injectable hydrator. So it's an injectable hydrator. It's not a filler, and so those of you who have been listening to us for many years, fillers are the hyaluronic acids, calcium hydroxyapatite. So I'm throwing you kind of these, the techno terms, but basically Restylane, Juvederm, Radius, those are fillers that we have been using for many years, injecting them into wrinkles, injecting them into deeper portions of a space to add more volume to a face. Those are the typical fillers. We're filling up space. What the company, and I have to give the company a lot of credit in that scale. That's Allergan. But what they did is they looked at what are the needs of the public, what are the needs of their consumer, and I think they've hit a home run here.
Really?
One of my jobs for you, right? One of my jobs, of course, Robin, as you mentioned, I'm up at all hours of the night doing research and looking at things, is to try to get through the minutia of what's the latest and greatest, what's new, because when cosmetic medicine kind of exploded in the early 2000s, we might see one little thing that would come up, and it might be on Oprah, and then that was kind of good for a good couple of years. Now it seems like we're getting the latest and greatest about every other week, and if not weekly, on social media. So part of my job is to research it for you, Robin, and for our patients, and to figure out whether this particular product offers what it says it will. Is it safe, and is it affordable for our patients? So let's get into it. Let's talk about SkinVive. Okay.
SkinVive.
So what they did is the company looked and said, what is the pain? What is the need or the niche for the consumer? What are they looking for? And the consumer may not even know that, but they look at themselves and they're looking at, they want to do something to feel better about themselves, feel more secure, more confident. And so one of the things that they may or may not be aware of is sort of looking at their skin and having a dull complexion or a sallow complexion, or maybe just having some irregular texture to it. Okay. And we tend to think of that maybe being as we age, or kind of looking, sorry, Gen Xers, I'm dragging you up with us baby boomers, and Michelle's kind of shrugging her shoulders, because she's a Gen Xer. But,
she looks like a baby.
As we age, we're beginning to lose moisture or water content in our skin. And so it begins to look frail and may look dry, cracking, not healthy, right?
Yes.
Right, and you're just saying yes, right?
This time of year is tough.
And
it just is.
Exactly. And so, Robin, I know that many of our listeners know your ethnicity, but what are your nationalities?
Italian.
Italian.
3/4 Italian.
Okay,
Yeah.
3/4 Italian.
Yeah.
So you know you have that Mediterranean blood, tends to be usually a little bit oilier, and so you were probably blessed with that really nice, I'm going to use the word plump skin, and it looked very healthy. Okay, and you were probably blessed with that when you were very young. But then as we get older, we begin to lose moisture in our skin, and so even in somebody who had a DNA advantage of being Italian or Mediterranean, you begin to notice that your skin is drying, and we don't realize in Northern California, even though we're California, how much we're in heat during the winter, and how dry we feel.
It's crazy because you're in houses now because it's cold outside. We're in the middle of winter, whatever you're listening to this, heading to spring, but it's warm, and so you're coming in outside, cold, inside warm, and getting older. I'm just saying, what is going on? And now I don't know what to do because things are changing.
Right. And thank you. That's perfect. What I would say is, when you wake up in the morning, are you a little thirsty, Michelle? You a little thirsty in the morning?
Oh yeah.
Right. Absolutely.
Sure.
So we don't realize that even when we're asleep and we're breathing, we're expiring with our breaths. We're expiring water. Okay, our body's metabolizing it, and that's why we feel thirsty in the morning. So. We tend to be a little bit more chronically dehydrated. And I know even in California, where we tend to be a little more health conscious than maybe in the Midwest where I grew up, and we're drinking water, what happens is that our skin falls behind. And then if we're a little sometimes too fastidious, and if you're washing a lot, you're cleansing your face a lot, which is important, you gotta take off all the makeup and everything else that you might have, but that can sometimes dry out your skin if you're not using high quality skin cleansers. So we begin to dry out our skin. And that begins to feel fragile. As I mentioned, maybe cracked, a little more susceptible. Our skin's supposed to protect us from the outside environment, and what happens is it feels like that barrier is breaking down. Hence, we don't look as healthy. Hence, we look a little bit older, maybe a little less attractive because of that, looking a little more fragile. So we want to reverse that. And it's interesting that what the company came along with is they took the same component that we use in most of the fillers that I use, and that's hyaluronic acid. And for those of you who listen, you know that I don't like the term acid because it sounds scary to people. I call it hyaluronic gels. But it's ubiquitous in living animals. So by ubiquitous, I mean it's everywhere. So if you take any animal and you break down the composition of the body and so forth, and especially in the skin and the connective tissue, you're going to find hyaluronic acid as a normal biological component of our skin. And so what they did was they manufactured, obviously sterilely in a lab, hyaluronic acid or hyaluronic gels to make filler. So now they're, always, they have their engineers working on it, their biochemists working on this, and what they found is that this is a really safe product, all right, really safe product. Well, how they change it, because they want to use it for different reasons, is that they change how it's cross-linked. So you might have molecule 1 of hyaluronic acid and molecule 2, they cross-link it or they connect it together in different ways. And I'm not a chemist, but that's sort of a simple understanding of how they do that. So they may do it differently for hyaluronic acid. For instance, let's say Restylane Lift, and I want to put a little bit in your cheek, and I inject it deeply in your cheek to give you nice fuller cheeks, make you look younger, all right? But that's going to be different than the hyaluronic acid that's in our Dr. Tom Quench line, which is hyaluronic acid, and it feels more liquidy, a little bit thicker than liquid. And you put that on your skin, and what we try to do is you get that hyaluronic acid to then penetrate into the skin, okay, and then deeper into the dermis. So our skin's made up of epidermis, which is the thinner layer of our skin, and the dermis. And if you're not if you're driving, everyone, but if you're just, if you are lucky enough to be sitting at home or in the office and you're listening to us, and thank you again, if you just sort of put your index finger out and you look at it from the side, the epidermis is going to be your nail, and then the pulp of your finger is going to be your dermis. So that's how much thicker your dermis is than your epidermis. All right. And I think that's a good depiction. So what we're trying to do is we're trying to get that hyaluronic acid to, like in our Dr. Tom Quench line, and you see it also, hyaluronics advertised on TV and radio everywhere. It's a big industry, big bucks. And so we want to get that hyaluronic acid to penetrate through the epidermis into the dermal layer.
Well, if you're buying quality products and you're using them sparingly so that you can get your money's worth out of it, yes, you want to make sure that it's going in there.
Right, and I have to say, I love the Dr. Tom Quench, okay, and we work with a compounding pharmacy to develop these, and I really like it. It's just part of my morning and evening routine. It's very, very simple to use, okay? So I really like that. Still, even using that, I sometimes feel like my skin is dry, and I'm used to having oily skin. I'm 3/4 Chinese and 1/4 Greek, and so, we tend to have a little bit oilier skin, which benefits us when we get older, but getting older, I'm a baby boomer, I'm beginning to notice that the hydration of my skin is going down. It's dry. So, and putting creams on it necessarily are not going to make that better. So what they did was, this company it's great, and to me it's because of the safety factor. They cross-linked the hyaluronic acid differently. So it's not a liquid, but it's not a gel like what I inject deeper to fill out, like areas that we need more volume in the face or into a wrinkle of the skin. Okay, so it's in between. And what we do then is we put a topical anesthetic on the skin, and it's FDA approved for the chin area like this. We can inject it in other areas as well, of course, but it's primarily for the side of the face, the cheek area. So, if you kind of touch your cheekbones with your hands and then slide them down to your jawline, that's the area that we work on. Okay. So what we do is we put a topical anesthetic on, and Karina was going to be here with us then, but she's our medical assistant, but her children had the cold, and so therefore, and of course, they're like little petri dishes. And
they are.
So she, right, Michelle, these little kids, so, so she got it. So she's, so she's not here with me today, but we're going solo. And what you do is you put a topical anesthetic on, or Karina would do that, and we let that sit there for about 15 minutes so it numbs up the skin. Then what we do, the treatment is 2 syringes. They're, for those who are really technical, it's a 1 milliliter or 1 cc syringe, a TB syringe, or an insulin-like syringe, okay? And you get 2 of them, and so we use 1 on each side. And so then we take the topical anesthetic off your face, okay? You can, when I'm teaching this, I will actually draw a grid on the face. And so what you want to do is, at this grid, you want to inject just in the dermis. So we're not injecting it deep because we don't want to waste it, and we're not injecting it so superficial that you feel a lump, that you see a lump, you see a lump. We're injecting it into the pulp of your finger, not the fingernail, okay, which is the epidermis. We're injecting it into the dermis, which is in the pulp of your finger. And we're injecting little, what we call micro droplets. So with that 1 ml syringe, 1 milliliter syringe, I'm probably injecting about 20 injections on one side of the face.
Oh my goodness.
So think about it as little pixels, okay? Everybody nowadays, we're all technical enough, we know about pictures, and they're made of pixels or digital images and pixels. So we're making about 20 little pixels. Now I have to say, when I do that, I actually probably inject closer to about 25 to 30 little injections. So I'm putting these little micro aliquots, little micro droplets in the skin, and we're injecting it just enough to place the hyaluronic acid or hyaluronic gel into the dermis. So we do that, okay? The concept is the hyaluronic acid absorbs anywhere from 50 to 100 times more its weight in water, okay? So we inject it in those areas, and then it begins to attract water into your dermis, okay, which is really great, okay. So instead of trying to put it on the top and having it go into through the epidermis into the dermis. We're injecting it. It's a direct delivery right into the dermis itself, and so Robin, what it does is, and now sucks in water into that area. It's like a water suck.
Like a sponge, a little sponge inside there.
Thank you, right. And so it's pulling the water in your body up into your dermis. And so your skin will look plumper. And it was really cute. Okay, I guess I can say this since I'm Chinese. I had a Japanese American patient who has a more classic Asian accent, and I was saying to her, so she said, well, so what is the purpose? What does it do? And I said, well, it's going to plump up your skin. And then listen to her say, plump up your skin. It was kind of cute. We just did this last week for her, and I just checked in her this morning because I knew we were going to talk about it. And definitely what you see, or what you can see, is that your skin looks plumper. It does. It looks plumper. It looks more hydrated. So what happens is this will dissipate over 6 to 9 months. So
how long does it last?
typically the company will say it's 9 months. Again, remember, I don't trust the companies for how long they say something lasts. So let's say 6 to 9 months.
6 to 9, okay.
But because this is pixels that we've injected, maybe 20 to 30 little injections on the face that's been anesthetized, what I would recommend for most patients is they come back at about 3 months, anywhere from 6 weeks to 3 months out, and have us repeat another treatment. Because I'm not going to be injecting them right in the same spot. So what you're doing is you're getting greater coverage of your skin. So you're getting more of a pan-facial improvement in your skin by having this hyaluronic acid be in your dermis and sucking water into it. So your skin's going to feel plumper. And it works very nicely. It's very tolerable. I actually had this treatment done in mid-December, right? So we brought it in, and Robin, I mentioned how we try to, we have to test these things out, okay? So our team, one night after work, we sat down, we worked with the company rep, we were looking at it, we had already read up and studied on this as well, and we underwent this treatment ourselves. And I will just now tell you my experience in that it's very tolerable. And Robin, how many years have we been working together? Who am I? I'm the king of weenies, right? I'm absolutely, the president of the weenie club, right?
Now, did you use the topical?
I did use the topical, okay. And most of the treatments, believe it or not, actually, when I do get filler treatments, most of the time I don't use topicals. But I think for this treatment, it would be good, just because, 1 or 2 pokes, most of us were pretty tough, we can handle it. But when you're getting multiple pokes, I think it just makes it more tolerable. So that topical, it made it very tolerable. I had the treatment. And when we inject that, you don't want to see lumpiness, okay? Don't want to see that. So that's our technique of micro droplets. However, if we do see it as a technician, a little technical point, what we'll do is then we'll really massage it. And because it's so soft, we can massage it down so it won't look lumpy. Now, having said that, I will tell you that for about a week and a half, even though, and I would ask our staff, I'd ask even patients that I was talking about, I would say, can you see, any lumpiness on my face? And they could not. And I would tell them that I could take my fingers and lightly kind of go, let's say, from my nose back towards my ear and feeling my skin. And I felt that I could feel where the little droplets were. So
and this was how far out that you could feel it?
I would just say probably up to about a week and a half, that I felt that I could feel it. But because I was excited about it, because I really loved the results. And you always can tell when I'm excited about something. I really love the results for me, okay? And in fact, I loved them so much, and just for the audience knows, a lot of time I'm excited about something, but I can't get in to get a treatment, I offer to do it for our nurses. Yeah, okay, and then when it's my turn, they've got an engagement. They got to go somewhere, right? So, I kind of last one to get it. But I absolutely, within 3 months, which is going to be soon, probably the end of this month, and I'm going to have them inject me again. And because I really like the way that my skin looks healthier. So because it looks healthier, and the word I would use is plumper.
Okay, I was going to say, what does healthy mean?
The skin looks plump and healthy. Just look at a young person versus an older person. The skin looks plumper, right? It's just how it is. Your skin is plumper than mine, Michelle, because you're you're younger than me, right?
She's like 25 years younger.
Right, and Robin, your skin, because you're younger than me, your skin looks plumper than mine, but I feel that it made a significant improvement. And what's so cool about it is that you don't look done. Okay,
Right,
it's
that's
just your
100%,
skin.
yeah.
You don't look like you had anything done, except for the fact that your skin looks better.
Do you have to drink a bunch of water in order to get that effect?
That's a good question.
Great question. I drink a lot of water anyway, so I can't give you a personal story about, oh, I didn't drink much water that day, and so it didn't look as good, and I drank a lot of water the next day. I think that that's very reasonable. You don't want to be dehydrated, so I would say that you want to drink. You don't have to be excessive, but you want to be well hydrated. That's important to get the best results. And it was interesting when I asked the patients, as I'm telling them about this SkinVive treatment, which is the injectable hydrator, the injectable hydrator, that I would then say, okay, I want you to feel my skin. You don't see any lumpiness, and I had it done last week, or I had it done 3 days ago. You don't see any lumpiness, and I want you to run your hand over my skin. Do you feel it? And they couldn't feel it. So it was more of the fact that I have my own sensitive skin, it's my body, we're kind of in tune to our own bodies, and as I ran my finger across there, I could kind of feel where those little pixels of micro droplets were. But I'd say after about a week and a half that I really couldn't feel them anymore, and I feel like I have lasting results from that. I do feel like it took years off my face by just having my skin be plumper. And I keep on thinking of my Asian patient who couldn't pronounce it as well. It was just so cute. I just loved it, But that it was just plumper, and it worked really well. So that's what SkinVive is, Robin, in terms of hydrating the skin. And I will tell you that I love it. I think that most of us could benefit from it. And even young people, so I've just mentioned about Michelle being, Michelle being a Gen Xer and myself being a baby boomer, but even the millennials and even the Gen Zers, as we get to about 25, sorry everyone, we begin to age. And so you can see the people who take good care of their skin, stay out of the sun. When they're 20, they look healthier and more youthful and more attractive than the ones who didn't. By the time they reach 28, it just happens. And so for those patients, I feel like this could be an early entry treatment for them. Once again, where you're not really changing the personality of the face in any way, you're just making the skin look more youthful and healthier.
Well, it sounds like you're getting your skin and your body to work for itself. You're kind of working these two in tandem.
Correct. This wouldn't necessarily be considered a biostimulator where we're stimulating our own biology. And we've talked about that with Renuva, the cadaver fat, or with Sculptra, which brings collagen, makes our body bring collagen. But it does tap into our own biological responses in that when you put that hyaluronic acid or gel in the dermis of the skin, because of its composition, it does attract water into those areas that have been injected.
So it's encouraging the
absolutely
that process.
Yes.
So is there a reason that it's only used on the cheek area?
Perfect. That was a perfect lead-in. Thank you. Great question. So it's FDA approved for that area, and that's where we are. But of course, now I have my magnification lens lit and as I'm treating my patients and I'm looking, and what I see is certain areas where maybe the skin looks better hydrated out, in front of your ears and up really high on your cheeks, but near your hairline. Well, we don't necessarily want to waste this in that area, and I'm looking, and then as I'm moving closer to the mouth, I'm noticing where you see smile lines, that those areas look a little thin. The skin looks a little thinner, a little bit drier, and then even over the lips, where women see vertical lines, and in the jowl area, that's where I see the skin thinning some, and where it looks dry, or less hydrated. So I want to make sure that you understand this distinction. I mentioned that this was an injectable hydrator. It's not a filler. So we're not erasing those vertical lines of the lips. I want you to hear me. We're not erasing the vertical lines of the lips or the smile lines around our mouth. But by increasing the hydration of the skin and plumping them up, they will look less, But I don't want to misguide you into think, oh, let's go get SkinVive and that'll erase my vertical lines of my lip. No, but will it look better Absolutely, and I can just tell you from being a cosmetic surgeon for over 20 years, you can see that the vertical lines on someone and they're there and their skin is not in good shape, it's not healthy, those vertical lines look very deep, okay?
Yeah.
But if your skin is, and that's due to usually just chronic lifestyle issues and their aging DNA, okay?
Sure,
That's
sure.
for some people, that's just the way it is.
Sure.
But if you've been taking good care of yourself, healthy lifestyle, hydrating yourself, maybe you're getting peels, you're getting other treatments with us, and you then add this injectable hydrator SkinVive, it can really make a big difference for you.
Okay. Can you, and let me ask you this, Dr. Tom, can you do SkinVive and a filler?
Yes, you can. Absolutely. You can
okay.
combine them. And actually, we do offer a little discount incentive for patients who, if they're coming in, they're having Botox or Dysport or they're having filler, that we can do this on their skin. The key here is that you do please let us know if you're interested in doing this, because we do have to take about 15 minutes of time to put that topical anesthetic on the skin.
Okay.
So we want to make sure, we never want to rush when we take care of you. It does take time to do that, so we kind of have to add that on to the treatment time in our schedule. But that's what
You can absolutely do it.
Absolutely.
At the
In
same
fact,
time. Okay.
that's probably where most of our patients who have been enjoying SkinVive injections have been those who come in for maybe their Botox and Dysport or filler, and they're talking to us about their skin, and we recommend SkinVive, and we go to that, and I text them afterwards a week later, and I have to tell you that the results have been very rewarding, that patients love the treatment.
And I see the SkinVive for the younger people that aren't needing the fillers yet.
Correct.
It would be that good base.
That's
that
absolutely, Robin, you
maintenance
were
with their
correct.
skincare.
100%, yes.
Okay, well, SkinVive, if you want to get in on it, you better call 707-542-8346. And remember them at drtomcosmetic.com. And again, thank you so much for joining us, everybody, for listening each and every week. Let's stay young together. And Dr. Tom, are you going to come back next week?
Absolutely.
Gonna
One
hang
way or
out
the
and
other,
show
we'll
up
be
with
here.
us? We're going to all be here. All right. Well, remember, give them a call because they get booked out, and it's 707-542-8346, drtomcosmetic.com. We appreciate each and every one of you for being here, and we hope to see you next week right here on KSRO. News is next.
Thank you.